Implant infections are a huge problem across medicine wherever implants are used. I work at an orthopedic hospital, one of the biggest in the world, and I am one of 4 full-time infectious disease doctors whose job is taking care of these implant infections.
This is a huge, huge problem that we have to handle. It's not just here in New York, but it's all across the country. It's in rural America, it's in urban America, it's in all walks of life. Everybody's sort of impacted by the possibility of an implant infection.
Implant infection refers to the situation where bacteria colonize a tissue-contacting biomedical device like a hip implant or a knee implant, any sort of device that's implanted in the body. And those bacteria then develop into a bacterial biofilm, which are very resistant to antibiotics.
An implant infection is a very, very serious complication. We focus on making implants for what are called revision surgeries, and we also focus on the oncological orthopedic space, so people that basically have bone cancer or soft tissue cancer. Our patient population gets infected to the tune of about 15 to 20% for most of our surgeries. And then certain specific surgeries, like a pelvic replacement surgery, can get infected about 50% of the time.
My main area of expertise is taking care of patients with cancer who also have infections, usually to reconstruct a body part after a cancer surgery, such as a mastectomy. A woman might undergo a breast reconstruction and have a breast implant placed as part of that reconstruction. And when an infection settles in on that, that's an implant-related infection. Also commonly, we might see orthopedic-related infections when people have bones or joints that are replaced as a result of cancer surgery.
I am 32 years old and I've had 8 surgeries on my right hip, which includes 3 hip replacements. This all started when I was 14 years old and was diagnosed with low-grade osteosarcoma in my right hip. That was treated with a partial hip replacement. A decade later, that had to be revised to a full hip replacement, which led to some further complications, and ultimately they had to put hernia mesh in the area to secure some of the hardware, and ultimately this got infected. In 2019, I walked down the aisle with a huge blister on the side of my thigh, which ultimately just exploded, and a week after my wedding day, I was in the hospital getting treated for my prosthetic joint infection.
The question of how devices get contaminated is really an ongoing, somewhat of a mystery, because the clinical outcome that we see is an infection, and we know when that happens, but that is so far removed from the actual contamination event that it's oftentimes very difficult to know.
Device contamination or device infections sometimes happen early because of the surgery. Let's say the bacteria gets in during the surgery, and sometimes they happen a little bit later, perhaps because of a delay in the wound healing. The skin hasn't closed all the way. And then sometimes you can get infections through the bloodstream, hematogenous infections.
The first time that the infection came, I didn't really understand what it meant. I knew it was bad news, but I didn't understand how bad. I thought an infection was something that could be treated with antibiotics and you go on. I didn't understand that it meant surgery, taking everything out, really painful procedures, really difficult drugs, a very long recovery process, being unable to work for a long time, an enormous toll on my family and my husband, on my parents.
If I had my wish, it would be to have material that by itself resists biofilm formation, but isn't itself a risk for infection.
So a lot of people think about the biofilm. We are trying to prevent the biofilm by killing the bacteria at the point of initial attachment to the biomaterial surface. So we do this by applying a covalent, non-eluting surface chemistry that mechanically can kill bacteria. And so the goal is to prevent the biofilm before it starts.
There's a lot of new technologies that can be developed. Having new ways of delivering therapeutics on demand when needed is something that's certainly achievable. Now, the question after that is how do you actually get this to patients? And I think that's the difficult thing.
I was aware that infections happened, but I didn't really understand what that meant. I think we're all familiar with, a strep throat. What I wasn't familiar with is that when you have an infection on hardware, it becomes something else entirely. It becomes its own kind of cancer in the sense that it's this invisible organism that's really hard to treat, that's really hard to detect, and really hard to manage.
It's not one person or one group can really overcome this big challenge, this big problem. You have to work with a regulation, industry, patient, doctors, researchers. So clearly you need all the moving parts being in the same room.
I constantly feel like I'm looking over my shoulder, waiting for the infection to reemerge, and constantly having to make very difficult medical decisions about how to treat it because there isn't a lot of information or options available.
There's many aspects to this issue that really need to be resolved. We really need to find a way to move research forward to engineer new implant coatings that prevent bacterial contamination and infection. We need new non-invasive ways to detect whether or not an implant is infected. The methods we use today are basically the same ones we used 100 years ago. And when there is an infection, we need to learn how to cure it. We need to find new ways to eliminate biofilms from implants. Scientists and doctors simply haven't been able to do that yet. These are very big challenges. But perhaps the biggest is this concern or problem of raising awareness across society to recognize this at a level that is comparable to the awareness that our society has about cancer. It's a significant but really underappreciated fact that the 5-year mortality rate associated with something like prosthetic joint infection, PJI, exceeds the 5-year mortality rate of breast cancer. That's a compelling statistic. All of us are well aware of the significance of breast cancer. I think relatively few people are aware of the significance of device-associated infection.
I think it's really important to not lose hope. I think it's hope that brings me to do this interview and to tell my story, because I hope that it can inspire people to do the work that we need to provide better outcomes for people like myself.